I'm Eliza for Stentage. I'm the nurse manager here at RMA. If you've already watched the videos, you may recognize me. Sorry, you'll have to listen to my voice. But we're going to just go through some of the medications that you may encounter through your journey here. And this is our first one, so there might be, a few growing pains. And we're hoping to record this, and hopefully by the end of the week or beginning of next week, it'll be available on our website. We're looking to do this hopefully every month, potentially featuring different medications. So if this month you don't have the medications you're going to use besides our website videos, hopefully you'll be able to attend next month, and we'll record that one as well. Okay, I think we can start. All right, so the first medication we're going to start with is called Gonal-f. Ignore the part that says expired on here, but this is what your box is going to look like. Everything that you need for the Gonal-f medication is going to be right here in the box. So all you do is open the box, and you're going to see in here, you're going to have your pen and your little needles or pen caps that you're going to use. Now this medication will be stored in the refrigerator. So you just take it out, 20 minutes before you're going to use it, just to let it thaw a little bit. And here's what your pen looks like. So the only thing you really need to be mindful of is on your pen, you have a dosing window. That's where you're going to dial up to your specific dose that your physician tells you to do. So everyone will be a little bit different. I'm just going to use one of our standard doses, but of course, whatever your team tells you is what you should follow. This is going to be a multi-dose pen. Every pen comes in different quantities. So again, just make sure that you're checking what quantity your pen is, and then figuring out how much you have in the pen and how much you'll have left, and keeping track of that. So this is a 900 unit pen, and the dose I'm going to be using is 300. So in theory, you have 3 full uses of this pen. Now, if you look at the side, they also have a little note that it contains actually 1,026 units. So there is some overfill in the medication. So if you end up doing your full 3 doses, put this pen back in the fridge, don't throw it out, and go on to a next pen, because there could be potential at the end of your cycle. If you need 1 extra dose, you could use multiple pens to get that. So moral of the story is just don't throw anything out until you've completed your cycle, and check in with your nurse. So the way it's going to work is you're just going to take the pen cap off, and then you're going to dial up to your dose. So I'm going to do 300 units. So you just click it up to 300. Now, the nice thing about the Gonal-f pen is you can't really see, but it says 300. The nice thing about this pen is if you go too far, you can just go all the way back. So you don't have to worry about resetting the whole pen. Now this is a multi-dose pen. So you want to make sure that since you're going to be using it multiple times, you're always going to be swabbing the top with alcohol. Okay. So my dose is at 300. I've swabbed it with alcohol. We're going to take one of our pen caps, and you're just going to twist it on. Now be careful, don't stick your finger in the pen cap, because there is a needle in there. So now we're on, you just go as far as you can go. Now, you're gonna have 2 caps. One is your white cap that you're gonna keep on the side, and then you have your blue cap. This one you're gonna be throwing out, okay? Now, we'll go through administration technique, but pretty much right now you're all set to go. Now, if there are big air bubbles, which is very rare, but if there are, you can technically turn the dial up to 25 units, push out the medication, and it will bring all the fluid up to the top. Again, that's very rare. If you see small little bubbles, you don't need to be concerned about them, and you can always flick it to get to the top. But usually there aren't really many air bubbles in here. Okay. Now, in terms of injection technique, all the injections that you're going to do for your stimulating cycle will all be the same technique. They're subcutaneous injections. Typically, we say you want to do it in the fatty tissue of the stomach, so 1 to 2 inches to the side or below the belly button. And all you're going to be doing is you're going to go straight in 90 degrees like a dart. So you're going to take this little cap off, and you're going to be careful to not poke yourself. The only technique you want to make sure you have is that the dialing dosing window is facing up towards you. And the reason being is once you inject the medication, it will go from whatever number you dialed it up to down to 0. If you take it out and it does not say 0, whatever number it says is how much more you need. So if that happens, you want to take the cap off carefully, put another needle on, and then dial up to whatever that dose is that you still need. So you're just going to go take 1 to 2 inches to the side or below the belly button. You're going to swab it with an alcohol swab, and then you're going to make sure that it air dries. So give it like a few seconds. Then with your dosing window facing up, you're going to go straight in 90 degrees. The entire needle is going to go in, and then you're going to be pushing it down all the way so that you see that this goes all the way down to the end. Okay, and then it's going to say 0. Then all you're going to do is you're going to take your pen cap or your needle cap and very carefully place it back on top of the needle. And you're going to twist it off the opposite way, so to the left. And then you're going to throw this whole needle into your red sharps container or biohazard bin. If for some reason your pharmacy forgot to give it to you, you don't have it, or you're traveling, you can always use anything that will close. You just don't want to throw an open needle into the garbage, so a water bottle, a Tupperware, anything like that. And then you're going to go ahead and recap this pen, and this is going to go back into the refrigerator. Okay, so that is Gonal-f. Does anyone have any questions? You can post them in the chat, in the Q&A section. Okay. We'll stop after each one, and we can have questions at the end as well. Is it pre-filled? Yes, the Gonal-f pen specifically is pre-filled. And again, you just want to make sure that you're checking what the order was for you. So this is a 900 unit pen. They do come in 300 and 450 units. So depending on what dose you're prescribed, you may get a different pre-filled amount. So you just want to make sure you're always keeping track of exactly how much you've used of each pen, so you know if you have to move on to the next one or if you need to order more medications. Do the needles hurt? Great question. All the needles that you're using during this this part of the cycle, so the stimulation part, are all going to be the same size. So they're small subcutaneous 27 gauge half-inch needles. So can't really see from here, it's far, but it's a very, very small amount. What I typically say is that a blood draw hurts more than the needles that you're going to use for this cycle. And again, they're all the same size. And the Gonal-f itself, particularly, I don't find that people say that it hurts, the medication hurts. And again, needle size will be the same for all the 3 medications that we do today. We'll go on to the next medication, but of course you can continue to ask questions as we go along. Now, the next medication we're going to do is Menopur. Now, this tends to be the one that people get a little bit tripped up on because it does take some chemistry and mixing involved. But I promise you that it's worse than it seems. So every box of Menopur is going to come with a box of the medication. And in that box, you're going to have 2 rows. So you're going to have 5 rows of the powder, which is the actual medication vials, and then 5 rows of the saline or sterile water. Now, depending on which Menopur you have when it was made, the colors can be slightly different. Usually the Menopur powders are peach, and then the salines are either gray top or pink. But just make sure you're always checking exactly which is the medication. And as you can see, we're going to see a little bit, the Menopur medication is actually a powder. So you'll notice the difference between that and the sterile water. The sterile water is just used to reconstitute the medication. The other thing that's going to come in your box is something called a Q-cap. And this is just a patient-friendly way to help you mix the medication. So there's just going to be a bunch in here for you to use. So we're going to be using our sterile water, our Menopur powders, our Q-cap. Then we're going to be using our syringes. Now, some of you will get a syringe that has this big needle on it. You're not using that, don't worry. Some of you will just get a plain syringe. It doesn't matter either way. And then you're going to have separate small little needles, and that's what you're going to use to actually inject the medication. So they're a light gray needle, again, 27 gauge half-inch, so very small. Now I'm going to use the standard dose of 2 powders or vials, but again, just make sure that you're following whatever your physician and nurse tell you to do. So I'm going to take out 2 Menopur powder vials. Now, the rule of thumb is, unless told otherwise, no matter how many powders or vials of Menopur you're instructed to take, you're only going to be mixing it with one of the waters. And again, that's just because the water is used just to reconstitute. It's not medication. And then the other portion of it is that each vial of water has 2 cc's or milliliters of it, and you're only going to be using 1 cc or milliliter, so only half. You're gonna have tons of extra waters, so you can just throw them out after you use that 1 cc because you'll have plenty. If by accident you use the entire 2 cc's, don't freak out, don't worry, you don't have to throw it out. That just means you're going to inject a full 2 cc's, and then the actual medication concentration will be the same. It's just going to be diluted in 2 cc's versus 1. So don't worry if that happens. Now, you're going to start by just taking the cap off of all of these vials. Try not to do it with the top of your thumb because it might break your nail, but with the bottom, just going to click them off. And then it's always good practice to go ahead and swab the tops of the vial. Again, if you forget to do that, you don't need to stress yourself out about that. Okay, now you're going to take your handy dandy Q-cap. You're going to peel it back. Now, again, you want to be careful. Don't put your finger in there because that is a needle. You're going to take this and you're going to pop it onto your water vial, and it clicks on nice and smooth. And take the plastic off. And then you're going to go ahead and move over to your syringe. Now, again, if you have a regular syringe, you just take it out and we'll use it. If you have this syringe that has the big needle on it, all you do is just twist that big needle off and you're going to throw it in your sharps. You're not going to use it. Now, this is just a friendly technique in terms of making sure it's a little bit easier for you to mix from one vial to the other. But again, if you do not do it, it is not wrong. They tell you to draw up some air into the syringe just to help with the negative pressure. It doesn't matter exactly how much you draw up. You want to drop usually around at least the amount that you're going to be withdrawing from the vial. So we said 1 cc, I pulled up 1.5, that's fine. And then you're going to take this and you're going to just twist it onto the vial until you can't go anymore. Now, you're going to push all the air in, and this is where the technique comes into play. When you flip over the vial, you want to make sure that you're holding the plunger down the whole time, and I'll show you why. So if I hold the plunger down and I flip it over and I release, I'm drawing back all the liquid. If I pushed it in, didn't hold the plunger and flip it over, you're going to pull a lot of air. Okay, so you're going to push down, hold, flip over, and then draw back. Now, again, we tell you 1 cc or milliliter. You don't have to stress yourself out about the exact line, but you'll see that there is a line that's clearly demarcated as 1. That's what you're going to want to go to. Now, as we go through mixing it, you will lose some liquid. It's impossible to get every single drop. That's okay. So we're going to get 1 cc of the water. And then you just kind of have to wiggle this off. Sometimes you might have it like spray a little. That's okay. Like that. And then you're going to go into your first vial and you're going to put the water into the powder. As soon as the water hits the powder vial, it's going to turn instantaneously into a liquid. If you do see that it's clumpy at all, you can always just swirl it a little bit from side to side. You don't need to shake it up and down. So now I push all the liquid in. Same thing, I'm holding down the plunger, flipping it over, drawing it back. Now you don't need to measure it this time because you know exactly how much you put in. You're just going to pull everything back. And it's okay if you pull some air back because we're going to push that out before we do anything. So we're doing 2 vials. So now I'm taking the first vial off. So now we have 1 powder of Menopur concentrated into 1 milliliter of water. I'm going to go to my second powder, inject again, flip it over, and draw everything back. So now I have 2 powders of the water in the 1 cc, 2 powders in the 1 cc of the liquid. Now we're done with this. You can actually twist off the entire Q cap with the vial on it, and that whole thing is going to go into your sharps container. You're then going to take your small little Menopur needle, and you're going to be just twisting that on. Okay. Did someone raise their hand? Now, this one I'm going to warn you. Although the needle is the same size as all the other medications, this medication does, the only way to describe it is like a burning sensation, like an internal burning sensation. You won't understand it until you do it. I tell you that so that you know that it's normal and you shouldn't be concerned that something is wrong. Unfortunately, it's just the way it's compounded and there's no way to change it, and it's always been like this. So just want to prepare you so you don't think anything's wrong. You don't have to hold the plunger when transferring between vials. Correct. You shouldn't have to, because the holding the plunger, it's a good question, is only when you have the pressure in the vial. So usually when you're switching from one to the other, you don't need to hold it back. That's a great question. Now, in terms of technique for injecting, it's going to be the exact same thing. The only difference is, because this isn't pre-filled, you are going to want to get that air bubble out. So when you take the top of the needle off, so you just pull it up, you're going to slowly push the plunger until you're going to see one drop of medication at the tip of the needle. Probably can't see it here, but it's going to be one drop at the top. If you lose 3 drops, don't worry, that's still fine. And again, same thing, swab the area with alcohol, pinch and into fatty tissue. You're going to go straight in 90 degrees, doesn't matter which direction it is. You're going to push the plunger the entire way until all of the medication has come out, okay? Then you take it out, and then this entire thing with needle, don't recap it, this entire thing is going to go into the sharps container. You're never going to reuse a needle, you're never going to reuse a syringe. Okay, so that one I feel like people might have questions on. It's a little more complicated, so if anyone has any questions. Move on to the next one. Okay, and the last one we're going to do today is called Cetrotide. Now, the nice thing about Cetrotide, like your Gonal-f, everything that you'll need for this medication is going to be right here in this one little package. So it's going to come in a white box. The Cetrotide is kept in the refrigerator as well. When you take it out, you're going to have this whole package that you open up here. And in here, there's going to be 4 items that you need. One is going to be the actual Cetrotide powder medication. The medication doesn't come pre-mixed, not for the Menopur, unfortunately. We have begged and begged and begged them, but it has a very short half-life once it's mixed, so that's why they can't pre-mix it, unfortunately, but maybe one day. Then you're going to have a syringe, and the syringe is already filled with the liquid, so there's no measuring on this one, so that one's a little bit more simple. And then you have 2 needles. You're going to have your big yellow needle, that's the one that you're going to mix with. I say for this cycle, if it looks too big, it is too big. So if it looks really big, you're not injecting with that one, you're just using to mix. And then you have your small gray needle that you're going to use to inject. So similar concept to the Menopur. So the Cetrotide is going to be started midway through your cycle. So the way the Gonal-f and the Menopur work, those are your cycle-specific hormones. So FSH for the Gonal-f, and the Menopur is FSH and LH. So those are the normal cycle-specific hormones you have in your body. And what we're trying to do here is give you those hormones at increased concentration to help recruit and develop as many of those small baseline follicles that you have to potentially get as many eggs as you have. Once you start to progress, we want to make sure that your body doesn't take over and pick 1 or 2 follicles to grow ahead of everything else, or that you would ovulate through. So we want to make sure we're preventing that. So to prevent that, we give you this medication called Cetrotide. So this one you're going to be starting kind of midway through your cycle. So at this point, you'll probably be a little bit more comfortable with the mixing because you're going to be used to the Menopur. So same thing, you have your powder vial, and you're just going to click the top off. You're going to swab it with alcohol. Then you're going to take your yellow needle, that's the big one. You're going to twist the back off, and you're going to twist it directly onto the syringe. Okay, again, just till you can't go anymore. Then you're going to take the cap off straight up. You're going to insert the needle directly into the middle, and you're just going to inject the entire amount of water in here. Now, this one doesn't dilute as quickly or as well as the Menopur does, so sometimes you do have to kind of move it around a little bit, or you can twist it on here. It might not be 100% clear, but you just want to make sure you're not having like big chunks of the white powder, so you can just kind of move it around. So you can't see, but it's clear. All right. Now with this one, when you flip it over to draw it back, you don't need to worry about holding the plunger because there's a lot of pressure in here, but what you do need to make sure is that the tip of the needle is going to be below the liquid, and I'll show you why again. So if it's below the liquid, then when I draw back, I'm drawing the liquid back. If at some point it's above, then all I'm drawing back is air. So you're going to have to move it as you draw it back, lower and lower below the threshold of the water. And then there is a little, I don't know how to describe it, but there's kind of like a little opening on the rubber stopper that you can keep the needle in and you can see it through. So you're going to go all the way to the bottom of that and you're going to pull all the medication back. Now, again, you're not going to get every single drop. That's okay. So now this whole thing is filled with liquid. Now we're going to take our cap and very, very carefully recap that big needle. And you're going to twist it off and throw it in your sharps container. Then you're going to take your small green needle, same thing, you're going to twist it off. We're going to twist it right onto the medication. And again, same thing, we're going to take off the top and we're going to get that drop of air. So you're going to just slowly push. Now this one, sometimes you have to pull back a little bit first on the plunger to get all of the medication in one spot. And then it does take a little bit longer for this to get to the tip of the needle because this like casing right here is just bigger than when you use for the Menopur. So it's going to take a little bit longer. And I know you're going to want to do it quickly, but you want to do it slowly so you don't inject everything out. Same exact technique, swab with alcohol, 1 to 2 inches to the side or below the belly button. You're going to pinch an inch of fatty tissue, straighten 90 degrees, make sure the entire needle is in. Once that's in, you can release the pinch, inject the full syringe, and then this entire thing is going to go into your sharps container. Now, something to keep in mind about the Cetrotide, a lot of times people have site reactions to that medication, which means usually within the 30 minutes to an hour after you do the injection, you'll have like a red, sometimes itchy or raised area right around the injection site. That's completely normal. It will go away by the time you wake up the next morning. But again, just something to keep in mind that you don't have to be nervous that there's something wrong. Obviously, if you have an allergic reaction where it's spreading and getting worse, that's completely different. But I would say more often than not, people will get that site reaction to the Cetrotide. Okay, any questions about that? Or in general at this point, because now we finished all the 3 medications we're going to do today. Or just questions in general. And again, we'll post these hopefully by the end of the week or beginning next week so you can see them in addition to our videos that are up there already. And then you can always check in with your team members as well. Are there any side effects? Okay. So the main side effects of the medications you're going to be taking during this cycle are going to be similar to kind of increased symptomology that you get when you have your period, because the hormones that you have, you're going to be having an increased concentration. So mood irritability, bloating, headache, nausea sometimes. I would say the biggest one is usually bloating and fatigue. Everyone's different though, so you can have something that's slightly different. You can always check in with your physician or your nurse to see if that's normal, but it's mostly those type of side effects. So my biggest recommendation is always to stay extremely well hydrated through the cycle, because the medications will bloat and dehydrate you, but you might not feel it in the same way that you would feel if you were out on a hot day. So you might not feel thirsty, but you are bloated and you are dehydrated. So not only just water you want to drink, but electrolytes. So coconut water, Pedialyte, Gatorade, vitamin water, things like that. I find that to be really helpful. You can typically take Tylenol throughout the cycle. Any other medications you want to check in with your team, any NSAIDs, so ibuprofen, aspirin, Advil, you don't want to do as you start to get closer to the retrieval, just because those are blood thinners and you will be having a surgical procedure, so that can increase your risk. But always check in with your team members if you have any specific questions about medications. Typically, how many needles, injections will you need to take a day? So in this type of cycle where we use these particular 3 medications together is typically what we'll call an antagonist cycle, which is one of the more common protocols that we do here. In the beginning of the cycle, you're just taking 2. You're taking the Gonal-f and the Menopur. Then you'll introduce the Cetrotide. So that's 3 medications. You'll typically only be taking 3 injectable medications until you do your trigger medication, which could potentially be 1 or 2 medications. But typically, you're not going to be taking more than 4 injections in one day. There is one protocol where you will do 4 injections in one day, but it's not this one, and it shouldn't be more than 4 as a general. Any other questions? Anyone want me to review any of them again or go over any specifics? Well, I implore you to always reach out to your team, call the office. Of course, my pleasure. With any questions along the way, and also feel free, we do have these medication videos for you to watch, but if you watch them before your cycle and you still feel like you have questions, or you can always come into the office and meet with the nurse and go over any specific questions you have with them. So I don't want you to feel that you only have to rely on this. Like if you watch them and you feel like you have more questions, you can always check in with your team. Okay, guys, hopefully we'll see you next month.